want to talk about jaw surgery, how it's done, the incisions and approaches, and some of the elements that are unique to how we do it. So jaw surgery, it's all done inside the mouth. So the incisions are hidden up in the mouth and underneath the lips. This allows us access to the facial bones, and we can move and reposition those. You're not wired together like you were 10, 20 years ago, and this is because they're small plates and screws made of titanium that enable us to stabilize the bones of the face once we move and reposition them. The unique thing is that we do this in an outpatient ambulatory surgery setting. So this is an ambulatory surgery setting. We do this in day surgery. And by doing so, this allows us to control the experience. It's very private. We have a dedicated team of anesthesiologists who are very comfortable and used to doing these procedures. We have a series of things that we do in our protocols that help limit things like nausea, vomiting. We limit the amount of pain medicine that needs to be administered, and we try to make it so that your recovery is as seamless as possible. The surgery itself here takes anywhere from 2 to 4 hours on average, depending on the complexity and what's being done. This time in the recovery room is approximately 1 hour. Most people, we have a lot of patients traveling from afar for the surgery too, and they stay in the area for anywhere from a few days to a week. Our protocol entails seeing you the next day. We obtain a CT scan the next day and make sure everything's going okay. We usually send you with a nurse and have a nurse that's visiting you the first night. And then we see you again at 1 week time point. Again, you're not wired together, but often we do place tight rubber bands to get your muscles of the face used to the new position of the jaws, and we loosen those at 1 week. People from far away can usually fly back home after that 1 week period. So typically we're saying jaw surgery is done with access all inside the mouth and hidden. And that's totally true except for the scenarios when we do concurrent TMJ surgery. So the most common scenario where I'm doing that is when there's something called condylar hyperplasia, where one side of the mandible and the TMJ in particular grows more and it's created asymmetry, pushing the mandible to the other side. So in those situations, we do sort of a facelift type of incision or approach in and around the hair and ear, and this hides very, very nicely. Since we're doing so many facelift and facial aesthetic procedures, we're really able to blend this quite seamlessly, and that's the one exception to everything being done inside the mouth. The other caveat of that is, in some cases of severe temporomandibular joint arthritis or resorption, rheumatoid arthritis, these kinds of things where the joint has basically shrunken away or there's inflammation, we might do total joint replacements. And when we do that, again, we do this similar to a facelift approach, and we place the joints that way, and the rest of the jaw surgery, again, is done inside the mouth. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.